Well, good afternoon to everyone. Thank you for being here and joining us online. My name is Rania Koltsida. I'm a respiratory physician working in Sotiria Hospital in Athens, Greece. I would like to thank the organizing committee for the kind invitation. I've been involved with COVID-19 patients since the pandemic started in Athens, and I'm in charge of the outpatient clinic for post-COVID-19 patients. And recently we have organized a pulmonary rehabilitation program for all these patients. Within the next few minutes, I'll try to explain what is pulmonary rehabilitation and why post-COVID-19 patients need it. First of all, pulmonary rehabilitation is a comprehensive intervention based on a thorough patient assessment followed by patient-tailored therapies, which include exercise training, education, and behavior change. It is designed to improve the physical and psychological condition of people with chronic respiratory diseases and promotes the long-term adherence of health-enhancing behaviors. The components of pulmonary rehabilitation are general exercise training, breathing training, and secretion clearance techniques. It also contains psychological support and patients' education, self-management. It includes nutritional advice, often smoking cessation, and of course, patient outcome assessment. So the main goals of pulmonary rehabilitation is to improve the body composition, increase physical activity, and promote mental health. It also helps to manage acute dyspnea, minimize everyday symptoms, detect and manage acute flare-ups of the disease, optimize pharmacotherapy, and also it facilitates smoking cessation and helps to establish social networking. When we talk about pulmonary rehabilitation, we need a multidisciplinary team consist of pulmonologists, physical medicine specialists, social workers, psychologists, nurses, respiratory therapists, occupational therapists, physiotherapists, general practitioners, pharmacists, and dietitians. And the benefits of pulmonary rehabilitation is, first of all, to minimize symptoms, reduce the intensity of breathlessness and lung discomfort, to improve muscle strength and patient's endurance, maximize patients' exercise performance, increase physical activity. It also enhances confidence, knowledge, increases patients' participation in everyday life activity. It also reduces anxiety and depression, and it helps to improve the psychological well-being of the patient. Finally, it improves health, quality of life, and increases survival. So, taking into account all the above mentioned, I'll try to explain why pulmonary rehabilitation is needed for post-COVID-19 patients. As you already heard, COVID-19 pandemic has created serious problems for global health and various types of complications and levels of functional impairment in millions of individuals recovering from the disease. As you already heard, post-COVID-19 patients suffer from symptoms such as fatigue, weakness, even a year after. They also complain of shortness of breath, dyspnea, cough, joint pain, chest pain. They have heart palpitations. They have problems with concentration and memory loss. Some of them complain of muscle pain, headaches. They sometimes feeling sick. They have loss of appetite, loss of smell, and many of them have problems with sleeping and depression or anxiety because of the post-traumatic stress. So the aim of post-COVID rehabilitation is to support a full recovery, to support symptom management, and to support a return to normal life. So when to start the program? As an outpatient, this is for patients with mild disease. As an inpatient, during hospitalization, even start in the ICU setting, and post-hospitalization, 6 to 8 months weeks after discharge. And where to start the program? As I already told you, rehabilitation starts within the hospital, within the ICU setting, or it's for outpatients 6 to 8 weeks after discharge, or there are some home-based programs for patients that that are not able to go to the hospital to have the session. Clinicians should be very careful with patients' evaluation before starting a pulmonary rehabilitation program. They need to assess the need for oxygen at rest and physical exertion, the dyspnea level, and also assess patients' physical, cognitive, and emotional status. They need to test peripheral muscle strength and also assess respiratory function by using spirometry. They need to check for heart problems and also assess patients' nutritional needs and be very careful with comorbidities. Clinicians also follow preventive measures, wearing the appropriate personal protective equipment according to local policy. And rehabilitation treatment plans should be individualized, as I already told you, according to the patient's needs and taking into consideration their comorbidities. Rehabilitation should be aimed at relieving symptoms of homelessness, minimize everyday symptoms, and improve patients' health and functionality. Patients should be reviewed through the rehabilitation process before and after. They should receive education about their condition. We need to explain how to manage recovery, how to manage their everyday symptoms. Programs usually start 6 to 8 weeks post-discharge and last for about 6 to 9 weeks. Patients come to the hospital 2 to 3 times a week, and sessions usually last 1.5 to 2 hours. We start with low-intensity exercise, particularly for patients who still require oxygen therapy, while we carefully monitor vital signs, heart rate, pulse oximetry, and blood pressure. And we gradually increase the intensity of exercise based on patients' symptoms. And the programs recommend that patients should have a frequency of 3 to 4 times a week, program for at least 45 minutes per session. And the exercise type includes walking, biking, muscle strength exercises for upper and lower extremities. It also includes airway clearing and breathing exercises such as diaphragmatic breathing, pursed lip breathing, and active abnormal contraction. Don't forget to educate patients, educate them about the clinical course of the disease, encourage lifestyle changes like adequate sleep, hydration, and proper nutrition. And also, it's very important to the psychological intervention to counsel about social support and also psychiatric consultation. Where in Sotiria Hospital, we organized a pulmonary rehabilitation program. We recruited first group of 15 patients post-COVID, 5 male and 10 female, aged 42 to 65 years old. All patients were hospitalized in the second pulmonary department of Sotiria Regional Chest Diseases Hospital in Athens, Greece, during February and March 2021. They were all critically ill. They suffered from respiratory failure during their hospitalization, and they had lung infiltrates in the CT scan. All of them complained about fatigue, breathlessness, palpitations, muscle weakness, inability to work and concentrate, and a lot of them had anxiety and depression due to post-traumatic stress 8 to 12 weeks after discharge. The duration of the program is 8 weeks. Patients come 2 times a week, and the session lasts for 1.5 hours. It contains supervised exercise training, breathing rehabilitation, and airway clearance. And the program also includes dietary consultation, psychological support, patient education, cardio function tests, and follow-up with CT scans, chest CT scans. And all patients underwent the primary evaluation, included dyspnea scale. We checked blood gases, lung function by spirometry. We also did 6-minute walk tests, sit-to stand tests, and blood tests to check thyroid function. We checked whether there were heart problems, and also we use quality of life questionnaires, quality of sleep, and post-traumatic stress questionnaires. So our patients will finish the program in July 15th, and all of them undergo all the tests included in the primary evaluation. I can assure you that already all of them feel much better. Their dyspnea and fatigue have decreased. They are more self-confident and have less anxiety. All of them made lifetime changes. They started workout, and they are more active in their daily activities. So in conclusion, pulmonary rehabilitation is one of the most effective management strategies to improve shortness of breath, to minimize everyday symptoms, to improve health status and exercise tolerance of patients with pulmonary disease, and for patients with post-COVID-19 symptoms. So I believe with proper measures and the immunization, we will be able to overcome this pandemic and its consequences. Let's all hope for the best. Thank you very much for your attention and enjoy your summer holidays. Thank you very much.